Welcome to the Workplace Violent Incident Online Reporting System for Hospitals. Cal OSHA has developed a series of 6 online tutorials to help hospital administrators and staff submitting reports understand the system and how to use it. In this module, we will provide basic information on reporting and give you an overview of the online reporting system. Who? The regulation requires that a hospital licensed by the California Department of Public Health as a general acute care hospital, an acute psychiatric hospital, or a special dental or maternity hospital report incidents of workplace violence to Cal OSHA. What? Hospitals must report the use of physical force against an employee by a patient or someone accompanying a patient. They must also report all instances of the use of a firearm or other dangerous weapon. When? Beginning July 1, 2017, hospitals must begin reporting or they will be in violation of the regulation. Failure to report an incident or failure to report within the required reporting timeframes discussed later is a citable offense. How? Reports will only be accepted through the online reporting system developed by Cal OSHA to receive reports from hospitals. Cal OSHA will not accept reports via phone, email, fax, or any other mechanism. What is a reportable incident? The standard defines a reportable incident as the use of physical force against an employee by a patient or a person accompanying a patient that results in, or has a high likelihood of resulting in, death, injury, psychological trauma, or stress, regardless of whether the employee sustains an injury, and or the use of a firearm or other dangerous weapon, regardless of whether the employee or employees are injured. For reporting purposes, the definition of injury is any injury that results in death, days away from work, restricted work or transfer to another job, medical treatment beyond first aid, loss of consciousness, or significant injury or illness diagnosed by a physician or other licensed healthcare professional. Hospitals must report incidents involving 1. A person who is on the hospital's payroll, covered by the hospital's workers' compensation insurance, and supervised by the hospital. 2. A person for whose services the hospital contracted through a temporary agency or other primary employer and who is supervised by the hospital. And 3. A person employed by an entity other than the hospital or a contractor to the hospital who is exposed to a workplace violence hazard in which the hospital A. created the hazard, or B. is responsible, by contract or through actual practice, for safety and health conditions at the worksite, and the hospital has the authority to ensure that the hazardous condition is corrected, or C. is responsible for correcting a hazard. For more information on employment relationships, see the Cal OSHA Policy and Procedure Manual posted on the Cal OSHA website. The standard has specific reporting timeframes. Hospitals must report within 24 hours any incident involving an injury to an employee that results in a fatality, requires hospitalization for more than 24 hours, or in which the employee loses a body part or is seriously, permanently disfigured, and incidents in which hospital personnel are exposed to a realistic possibility of death or serious physical harm, or in which a firearm or other dangerous weapon is used. All other incidents must be reported to Cal OSHA within 72 hours. Let's look at the online reporting system. To give you an overview, hospitals log on to the online reporting system, complete and submit the online report form, and the data is committed to the Workplace Violence Incident Database. Let's take a closer look at some of the important features of the system. Secure login. Individuals making a report for a hospital facility must sign into the system with a unique username and password. Cal OSHA has developed processes to ensure that only individuals authorized by the hospital may submit a report. These security processes, hospital pre-registration and user registration, are discussed in Modules 3 and 4. Password reset. The system has a password reset feature, which allows users to reset their password at any time. Users do not have to contact Cal OSHA to reset their password. Report receipt. Once a report has been submitted to the system, the database will automatically generate an email receipt with the date and time the incident was submitted, a record of the information reported, and a system-generated unique ID number for the incident. Module 5 discusses this in more detail. Revision capability. A user can revise a report to correct errors. Report revision is discussed in detail in Module 6. Review capability. An individual user can see his or her previously submitted reports at any time using the unique ID number for the incident of interest. Viewing reports is discussed in Module 6. However, the system does not support looking at all of the incidents for a facility at the same time. As a workaround, we will periodically provide hospitals with an Excel spreadsheet of all the reports submitted for their facility. Cal/OSHA read-only access. Cal/OSHA has read-only access to the database and cannot edit or change submissions made by the hospital. Hospitals are responsible for the completedness and accuracy of their reports. Additional information on reporting requirements and the online reporting system is available in the FAQs posted on our website. Please visit our webpage by clicking on the link in the video description below, or you can email us at doshwp@dir.ca.gov with your question. For more information about the Workplace Violence Prevention in Healthcare Standard, please visit the Other Resources section on our webpage. Our webpage link is available in the video description. This video provided a brief introduction to reporting of workplace violent incidents by hospitals. Cal/OSHA encourages you to view the other Workplace Violent Incident Online Reporting System tutorials for more information about the system. Thank you for viewing this introductory tutorial. See you in the next tutorial.